Hello and assalamu alaikum. I'm very thankful to the event organizers for inviting me to this prestigious conference. So I'll dive right away into my presentation. As far as my introduction is concerned, my name is Dr. Qaisar Raza, and I'm working as assistant professor in Department of Food Science and Human Nutrition, University of Veterinary and Animal Sciences, Lahore. The topic of my presentation today is public health nutrition challenges in Pakistan. So let us first try to understand. By the way, the thing about as I'm, recording through Zoom, so this, like the bar will go away uh, in a minute or something like that. So don't worry about that. So let's first try to understand what is public health nutrition. Public health nutrition is actually the promotion of health and eradication of diseases by applying the nutrition principles and implementation of initiatives to contribute to improving environmental determinants of dietary intake for the prevention of nutrition-related diseases. As we all know, and this is also very important, that a balanced diet is the panacea to combat all the communicable and the non-communicable diseases. This is very important, right? Um, And then proper nutrition is essential for supporting optimal growth, development, and overall well-being. If you look at the National Nutrition Survey, this is the Pakistan National Nutrition Survey. I'm also trying to get rid of this thing above so that it goes away so that everything is clear to you. Yeah, it has started going away. So let's talk about Pakistan National Nutrition Survey, which tells us about the prevalence of different diseases or the problems within the Pakistani community. This data mostly talks about the children under the age of 5 years. So here we can see the first problem is related to stunted. Stunting is when children do not have appropriate heights according to their age, and you can see there is high prevalence of stunting among both boys and girls in Pakistan. And the second one is about wasting. Wasting is when children do not have appropriate weights uh, based on their heights, and there is also high prevalence of that. Underweight, the problems of underweight is related to undernourishment, and there are a lot of children who are suffering from this problem. But for me, the how do you say that the changing trend is about the overweight. The children who are overweight. You can see that they're like 10%. Almost both boys and girls or children, both male and female children who are overweight. Now, this problem of childhood obesity is very alarming in the sense that now we have like triple burden of diseases in the sense that we have underweight children, we have overweight children, and then we have nutrient deficient children, or micronutrient deficiencies. That is also called as hidden hunger. Actually, this problem of overweight is related to the phenomena of nutrition transition. Nutrition transition that has been explained very well by Barry Popkins, where they tell us about the fact that when people migrate from, or sorry, when the dietary patterns start changing from the traditional dietary patterns to more fast foods, that is called a nutrition transition. And we know that our urban centers and maybe in some rural centers, there is increased eating of fast foods, which is why children and adults and older people, they're getting overweight and obese also. There are some things about food security and early initiation of breastfeeding are also mentioned here, which are also alarming, sort of. And then we talk about the micronutrient deficiencies in children under 5 years of age. Look, micronutrients are very important to ensure many important physiological and psychological functions of the body. Let's talk about iron. Like here you can see that 28.6% children are deficient in iron, which is a huge number. Iron is responsible for producing blood within the body, so, and heme, it attaches with the heme, which is also called as hemoglobin. So if this iron is deficient, that can lead to iron deficiency anemia, which is quite there's quite a high prevalence in Pakistan, especially among women or girls or children. Uh, and then vitamin A, as you can see, carrot and these kind of things, there are like 12.1% children who are severely malnourished in terms of vitamin A, which is responsible for your, proper vision, so we can see the things. And then zinc, it's also an important and essential micronutrient. It is responsible for your hair growth, your nails, and then um, your skin. And you can see that 18.6% children are deficient in zinc. Then vitamin D, there are like 13.2% children who are deficient in vitamin D. Vitamin D is responsible for your bone mass. Many people who suffer from osteoporosis or osteomalacia, osteopenia at later stages, they have deficiency of vitamin D. And eating habits start from the childhood. Then there is severe deficiency of iodine among 7.3% children. Moderate deficiency 23%. Iodine is responsible for thyroid, as all of you know. So it's very important that this issue needs to be addressed. Complementary feeding practices, if you look at them, complementary feeding practices are the feeding practices related to the breastfeeding, which are given along with the breastfeeding. That process is also called as weaning, which starts at 6 months. If we look here and then we see the minimum dietary diversity, only 14.2% children have minimum dietary diversity. Dietary diversity is like when you're able to eat all the food groups in a balanced diet. Minimum meal frequency, only 18.2% have minimum meal frequency. That is when you're able to get enough energy from the meals. Minimum acceptable diet is, uh, you know, like when children they're getting enough nutrients from the diet, and only 3.6% have access to that. So these are the numbers that we need to be looked into. If we look at, if we stratify the data based on urban and rural areas, we can see that in urban areas, it's a little better. The situation is a little better as compared to rural areas. For example, the minimum dietary diversity in urban areas is 17%, and in rural areas is 12.6%, which shows that the rural areas, they might have like awareness regarding nutrition or the income level, all the resources. So this certification provides us good insight into developing interventions, especially nutrition intervention, the dietary intervention. And if we look at the water sanitation and hygiene, we can see that in Pakistan there is a problem of drinking water, which can bring about many diseases. Uh, you know, Here we can see the data which is given based on coliform, the presence of coliform and E. coli in the household drinking water. These are the bacteria, which can cause diarrhea and related problems. If you stratify the data, if you see the stratified data between urban and rural areas, you can see that it's almost the same, but it's on a little higher side in case of rural areas. Now, this also needs to be looked into. And then if you look at the percentage using improved sources of drinking water by province, although it's quite high among all the provinces where the presence of E. coli and uh, uh, you know the coliform is present, uh, but then the improved sources of drinking water are more in Punjab. They're less in Balochistan. So Balochistan has more problem with the bacterial water, the bacteria infested water. All right. Now the estimated poverty rate according to World Bank, poverty is an indicator of malnutrition. Sort of poverty and malnutrition go hand in hand. So if you look at the report of the World Bank, you can see that the poverty rates are quite high. Like consistently high in Pakistan, as it is a developing country. Although they have reduced not drastically, but to a certain extent, where if you see the data of 2021, it was like 39%, and now it has reduced to almost 37 or 38% in 2020 and 2023, but still it's on the higher side. What are the factors contributing to malnutrition? That is also very important. The first factor that is related to it is food insecurity and insufficient nutritional intake. Food security is defined as when you have availability, accessibility, and affordability of food. Insufficient nutritional intake is when you know you do not have uh, do not eat a balanced diet. So this is one of the factors contributing to malnutrition. Then is the social status. Social status is basically based on your income levels, or your socio-economic status. The inequality, that is the wealth inequality, uh, which breeds or provides a ground for malnutrition. Maternity care is also very important. If a mother is not healthy, the child is not healthy. Environmental factors are related to food environment and physical environment. If those factors are, better, we can expect, uh, you know, better health of people. Poverty relates to the socioeconomic status again, or the income levels. Water sanitation, hygiene, we have talked about it, that how it can, if you do not drink clean water, you can have diarrhea, you can have, vomiting and fever and these kind of things. They're very important. What are the dietary guidelines of Pakistan, and how can they help in, addressing these problems that we have talked before? So the first one is maintain normal body weight by consuming all food groups and performing regular physical activity. That is very important. Half of your daily cereal intake should include whole grains. Eat 5 servings of fresh fruits and vegetables every day according to WHO. Take 2 to 3 servings of milk and milk products in a day. Consume meat and meat products, fish and eggs in moderation. Remember, meat and meat products, they provide you protein. And protein is very important in your lean muscle building. Our body is composed of both fat mass and lean mass. We need to have more lean mass and less fat mass. Protein and vegetables and fruits, they play a very important role in that, and all of the things that we're talking about. And limit consumption of edible oil and fat in cooking. Reduce sugar intake and limit intake of soft drinks, confectioneries, bakery products, and commercial food drinks. Limit consumption of fatty foods and highly processed foods. Women should increase intake of all the food groups daily, especially food that are rich in iron, and take extra care during pregnancy and lactation. We are saying because there is half of the Pakistani adult women, they are deficient in iron. They are suffering from iron deficiency anemia. That is why we are especially, we're especially talking about it here. Read nutrition labeling on packaged food products. That is also very important. That is how you'll be able to control your extra food and sugar intake. Conclusion. To me, there are a lot of public health nutrition challenges in Pakistan, and all the stakeholders, including government, non-governmental organizations, healthcare providers, and communities need to come together and join hands to address these challenges. Governments can make policies to provide cost-effective fruits and vegetables or healthy foods to the people, and then non-governmental organizations can give a way to the government. For example, UNICEF, it has helped a lot in producing the National Nutrition Survey. And the healthcare providers, be it the tertiary healthcare provider or basic healthcare providers, they should not only be able to provide the curative measures, but also the preventive measures. Then the communities, they should come together. They should increase awareness among themselves and take into their own hands the things. For example, I'm a professor in university, so if I talk about the student community should learn more about nutrition, develop more awareness, and then also spread that knowledge to other communities. That's all from my side. I hope you have learned something from my presentation. Thank you, Dr. Ghulam Hussain, for inviting me to this prestigious conference. And yeah, I look forward to seeing you again. Thank you.